Morning.
Good morning, Commissioners. I am Wilfred Romero, Executive Director of the Pikes Peak Region. I'd like to thank you for allowing me to be here this morning to talk to you a little bit about our Building for Change. But before I get my presentation started, I did want to ask the Commissioners if you are familiar with the ARC of Pikes Peak Region.
Shop there.
You shot that? All right.
I donate there.
You donate there, good. You know, that actually is the answer that I was searching for, because we are actually the purpose behind the shopping and the donations to the ARC thrift stores. And we thank you for your donations there and your shopping there, Commissioner Littleton. What we are, the ARC of the Pikes Peak Region, is a nonprofit agency that provides services to individuals with intellectual and developmental disabilities. And we do receive 88% of our funding from the ARC thrift store. So again, thank you to all of those who do donate to the ARC thrift stores and who also shop there. The mission of the ARC is to promote and protect the human rights of people with intellectual and developmental disabilities and actively support their inclusion and participation in the communities of the Pikes Peak region throughout their lifetime. Our vision is a community where all individuals with intellectual and developmental disabilities are embraced and respected. The ARC of the Pikes Peak region serves approximately 2,000 individuals annually, and our vision is a community and a world in which all people are valued and have the opportunity to achieve the highest possible level of self-sufficiency, independence, and inclusion possible. The history of the ARC: we have provided services for approximately 61 years here in the here in the Pikes Peak region. We are organized by a set of parents who refused to put their children in institutions, which was the case during those times, and they felt that their children had every right to live in their community, to be participants in their communities, and to go to school in their communities. Over the past 61 years, we have successfully worked with local and states to advocate on behalf of individuals with disabilities to make sure that those long-term goals and their visions of being part of the community would come about. We have an experienced staff and dedicated volunteers who support our community partners to strategically concentrate their efforts and create the deepest impact, directly challenging the structural and barriers limits to quality education, access to health care, economic security, and equal representation. Of the work that we do at the ARC of the Pikes Peak region, there are 4 areas of emphasis. It's advocacy at the legislative level, and I've been spending quite a bit of time there myself and listening to some of these bills that are impacting individuals with disabilities. We provide educational advocacy. There are 17,000 children in El Paso County alone that are receiving services through an IEP. Our advocates go to the schools with those children and their families and make sure that the parents are asking the right questions and that our schools are providing the services that they are required to provide under the law. And it's very important that there is representation there, because it doesn't matter what background, where you come in your walk of life. Disability language and the rules and the regulations set around disabilities is very tough to navigate. So it's important for the success of our children in school that they do have an advocate on hand to work with our children. But remember again that number, 17,000 plus kids in El Paso County. We also serve Taylor and Park County, who are on IEP services here in this community. We don't do this ourselves. We are a partner with a lot of the other disability agencies and nonprofit agencies here in El Paso County. We partner with Special Kids, Peak Parent, the Resource Exchange, Community Outreach, Stellar Care, Carmel, the Library District, and a variety of other agencies here. The reason I tell you that is because we are not in competition with any of the other service providers here in our community. What we do is we enhance the services that are being provided, and we do that at no charge to our community. All of the services that we provide when you come into the ARC are done at no cost, or if there is a fee for a social opportunity, we do that at a very limited cost. So again, that everybody has the opportunity to participate in our programs. I wanted to open your eyes to some interesting facts around individuals with disabilities. And I won't go through all of this on the PowerPoint because I know my time is limited, but I did want to bring again the attention to the concerns that we have around disabilities and the needs as we build our future here in Colorado Springs. Among adults who are developmentally disabled, as many as 83% of females and 32% of males are victims of sexual assault. In addition, the 49% will experience 10 or more assaults or abuse incidences in their lifetime. That's a huge, huge number. According to the report from the Bureau of Justice Statistics, persons aged 12 or older had disabilities experienced an estimated 1.3 non-vital vital crimes in the areas of rape, sexual assault, robbery, aggravated assault, and simple assault. In 2013, the rates for violent victimization crimes against persons with disabilities was 36 per 1,000, more than twice that of age-adjusted rate for persons without disabilities. If that was the case for our typically developing individuals, I think we would be up in arms in our communities knowing that our children are at risk of being sexually abused at this high rate of time. Across our 4 studies of Miranda comprehension and findings are quite consistent with the showing of persons with intellectual and developmental disabilities, and they have significant deficits understand the appreciation of Miranda warnings. We have found that there are a lot of individuals mixed up in the criminal justice system who do not understand the Miranda rights. We have found that individuals with disabilities are confessing to crimes that they did commit at a high number because of the interrogation practices that are used in the lack of understanding of disabilities and the services that are needed to make sure that accommodations are in place for our individuals with disabilities. The ARC also provides guardianship to 75 individuals in our community who do not have families or friends or natural supports to provide those services for them. We make sure that their health is in place, that their home is safe, and that they are receiving all of the services that they need. And again, we do that at no cost to our community. Education is the third area of the services that we provide, and I'll go back a little bit to our statistics. I got a little bit off on my PowerPoints there. Education is a huge area that we provide for our community. Education around disability services for our caregivers, for individuals with disabilities, for law enforcement, first responders, parents as well. Social opportunities are key for individuals with disabilities. Individuals with disabilities tend to pass away more frequently from loneliness than they do from alcohol or drug-related incidences. And that's just because isolation is so huge amongst the disability communities, and those social opportunities are very, very important. I'll go back to my statistics here. 1 of 68 U.S. children has autism spectrum disorder, a 30% increase from 1 in 88 2 years ago, according to the 2014 report released by the Census for Disease and Control Prevention. That means that more and more individuals with disabilities are going to be living in our communities, and is our community prepared for these individuals? The Autistic Self-Advocacy Network reports that more than 90 people with disabilities have been murdered by their parents over the last 5 years. According to the National Council on Disability, the general trend in these cases is that the perpetrators receive comparatively little or light sentences and tend to be seen as victims of the system that doesn't provide enough resources for children with disabilities and their families. And that's the important part around education for our caregivers and making sure that they have the right supports in place as well. It is not strange to find that a lot of our aging caregivers are wondering who is going to take care of their children when they pass. We all know that as we age, we also become disabled. 40% of family caregivers care for special needs child, with an estimated 16.8 million caring for children with special needs under the age of 18. In transitions and employment, building independent living skills in the transition is just as important as preparing for employment. According to the ARC Center for Future Planning and State data, 3.5 million people with IDD are living at home with their families, parents, or caregivers. One of the statistics that is alarming is that 36% or even higher of our children coming out in transition services are finding themselves on the couch, or they are finding themselves in jail. 85% of the people with disabilities are unemployed. Access to health care is also a challenge for individuals with disabilities. Access to dental care is an area of serious concern due to part to fear or difficulty in completing dental visits, part of the lack of dentists skilled in treating people with IDD, and part of the lack of mandatory Medicaid coverage for adults with dental care. And again, that leads back to our education in the community, and working with our professionals is working with the medical professionals to also understand the needs of individuals with disabilities. Why am I here? I'm asking for your support, commissioners, as we move forward with our building renovation project. The areas that I mentioned today are areas that are concerns for all of our communities throughout the United States. We have done a great job of shutting down institutions starting in the 1990s, but we have done a terrible job at preparing our communities for individuals with disabilities and to successfully live in their communities. It's important through our building renovation project that the supports that are there in place for individuals with disability remains in place for individuals with disabilities as they transition out of high school. Over the past 35 years, we have occupied the same facility, which is located on 12 North Meade, right across the street from the Memorial Park, and real close to the skating park, if you're not familiar with that area. The growing and expanding needs of our clientele and demands of our clientele cannot be met in our current facilities. We are in need of significant renovations. We speak about accessibility, and I know the county has dealt with some accessibility issues here in our community in itself. But as much as we would like to preach that all facilities should be accessible, we ourselves struggle with having accessible buildings just because of the year that it was built and the fact that over the past 35 years, no major renovations have taken place. Accessibility is a necessity, no ifs, ands, or buts about it. Building renovation will enable us to significantly expand the scope of the services that we provide and help meet the future needs and the demands of the IDD community and assist individuals to achieve their full potential. In our facility, and there's a little breakout of what we're looking at with our facility, the big room, number one, there is a state-of-the-art conference center to provide the training and have the space available that will meet the needs of individuals with disabilities, their caregiver, and our community in general. All of the facility, again, will be accessible for our individuals to do that. The state-of-the-art conference center is available for our community and all of our disability partners that we have out there, as well as other programs that serve children with disabilities, such as Head Start, our library systems, TRE, Special Kids, Special Families, Carmel, so forth. Number two, there is a learning kitchen. As I mentioned, the supports for transitional students fall off. The very next day, they're through with their transitional program. And to better serve these individuals, those supports still need to be in place. We will have a learning kitchen there that will provide lessons on how to prepare a meal, how to wash your clothes, how to prepare for work. We'll have a computer lab where we will have an outreach worker available to assist individuals with disability applying for jobs. Again, keep that number in mind. 85% of individuals with disability are unemployed. It does not mean that they don't have the skill sets to be employed. It means that there are a lot of barriers out there. A big part of that are access to computers. Anymore, you cannot put in a job application unless you are able to put that in online. A lot of the applications are confusing, so we'll have an outreach worker there who will assist the individual navigate the page and get in the application, so forth. We will also have a library. We were one of 5 ARC chapters throughout the United States, and there are 700 chapters throughout the United States. We were one of 5 who were selected to offer the National Criminal Justice on Disabilities Center Library. And in our library, we will have resource material for our law enforcement officers, for our criminal justice professionals to come in, to do the research that they need and make it more accessible for them as they deal with individuals with disabilities, and also to assist families who come in and are looking for educational information around disabilities and how to work with their child once they've been diagnosed. That's one of the errors that we have in our community, is that many times once the diagnosis is made, the parent is left to navigate the system without any resources whatsoever. So we will make this available to them as well. Number 6 is a multi-purpose room, and our goal is to bring in the medical providers. We will work with DDHEs, which is the Developmental Disabilities Healthcare Center, and increasing access to healthcare. Again, the statistics around healthcare are alarming. If it was to, again, the typically developing population, we would be doing more about making sure that our children and our family members are receiving the health services they need. And that is also the case for individuals with disabilities. We need to make that, those services accessible. The goal is to be the premier intellectual and development disability human rights organization for our participants, our donors, our volunteers in the greater Pikes Peak region. What I'm asking you again is to support the ARC in our efforts at renovating our facilities so that we can continue to provide the services that we provide to our community at no cost or at a very, very reduced cost. I ask for your support, one, because without your support, things aren't going to move in the disability community. It moves very slow as it is. But again, keeping in mind the statistics that you have in front of you, those are just a few examples of the concerns that we have as a civil rights organization, and making sure that all of our participants have an opportunity to be part of their community, to live successfully in their community. What I'm asking the commissioners again is your support. If you could write a letter of support for our efforts, I would appreciate that. On March 22nd, March 22nd, we will be doing a signature event, and I would like to invite the commissioners to attend that event with us. It will give you more of an explanation around the needs of our facility and the goals of the organization itself. And I will hopefully, through this, will show our community that this is not only an issue that we're concerned about at the state level, but that we are concerned about it at the county level as well, because we do serve, again, 3 counties here in the Pikes Peak region, and there are 17,000 plus kids who will be entering our community, living on their own, out there looking for work. We must make Colorado Springs a model community to follow, and that is my request for you commissioners.